Hi everyone, my name's Kate. I'm the PA that works with Dr. Tyrone here at North Florida Plastic Surgery. Today we're going to be telling you a little bit more about RHA, which is resilient hyaluronic acid. It is the newest, the latest and greatest filler on the market here in the United States. So at the end we're going to be taking questions. We're going to be telling you a little bit more about it as we go, and we're also going to be giving away a free RHA treatment. So stay tuned, and we'll be doing that at the end through the Zoom chat, okay? So I brought RHA into the practice because I want to be able to give my patients options. Not everybody is the same. We're all a little bit different. So if you're looking for a very subtle but also dynamic result, this is going to be your filler. It's mostly really for people who want to give nice subtle results to their dynamic folds around their mouth. So if you're concerned about your nasolabial folds or some of the laugh lines that you've gotten as you've aged, then this is a great option for you. So the advantages of using RHA is that it is the least cross-linked and also uses the longest hyaluronic acid chain. So I know that kind of sounds very technical and very sciencey, but basically what that means is that it makes it harder for our bodies to break down. The least cross-linked something is, the less easy it is for your body to break it down. So you're, going to get these long-lasting results. If you like what you see, those results are going to last a long time. So results can expect to be seen immediately. These may not be your final results though. So you're gonna walk out of here with the results that you would like to see, but unfortunately the next few days your swelling is going to continue to go down. So after the swelling has resolved, you will see the final results, which takes about 2 weeks on average. Some people see it a little bit before, some people see it a little bit after. So when the product is first placed, it is totally normal to feel the product within the skin. Of course, you just have something new introduced to your skin. After the next 2 weeks, it's going to soften up tremendously and it's going to look very natural and normal. So anybody is a candidate for RHA filler. If what you're seeing in the mirror you're still happy with and you're still feeling youthful, but you're starting to see a little bit of volume loss, let's say in the nasolabial folds or maybe the cheeks, or you're starting to notice some lines that weren't there before, you're a candidate. There's really no restrictions on who is not a candidate. Young, old, just come in for a consult and we can absolutely discuss if you're a candidate or not, okay? Previously, fillers have always addressed loss of volume, how the face looks in static rest. So kind of looking forward, we've had a hard time finding out how do we have filler look natural not only at rest, but also in motion. Here comes in RHA. So we want to not only look great when we're at rest and neutral position, but when we're smiling, chewing, laughing, talking with friends, we want these dynamic motions to also look very natural. So this is where RHA comes in. The longer chain hyaluronic acid is the closest to our own natural hyaluronic acid, and it also is the least cross-linked, making it easier for it to move within our skin. So that is the primary reason why I'm bringing RHA into our practice. So this is Sarah. We're going to be filming today for RHA. It's a hyaluronic acid that has been FDA approved here in the United States to treat nasolabial folds and dynamic wrinkles. So Sarah, go ahead and take your mask down. Thanks. So when you look in the mirror here, tell me things that when you see yourself, what you would like to correct.
So I've noticed that my nasolabial folds have been deepening recently. I also noticed that this line here has gotten more apparent, and especially on this side, there's kind of it's as though like the fat has like moved downwards and there's a little bump on the side. And then otherwise, I like to get this chin snatch. And I feel like my chin has been like kind of going backwards. It looks a bit smaller than it has in the past.
Gotcha. So these are all totally normal things. You're a young, beautiful woman. You really don't need anything at all. However, there are things that we do start to notice or change about ourselves as we age. We all notice it. So I agree with you. I do think that your chin could use a little bit of more protrusion to balance out your facial features. I think that getting rid of that little line is just a separation of the fat pads in the cheek area, and we can certainly make that more subtle. I would also like to kind of soften your nasolabial folds there and just keep you looking as youthful as you feel, okay?
Sounds good.
Awesome. So I will say these little lines right here are probably gonna be the toughest to resolve. Everything else is gonna be pretty straightforward, but I don't want, you already have such beautiful cheeks. I do not wanna add too much product to your cheeks. So that's gonna be a really subtle change, okay?
That sounds good, actually. I always thought those little lines were cute. I
They
just
are kinda
noticed they got
cute.
more deeper recently.
Right. No, I totally agree. They're really cute. All right, perfect.
Oh my god.
So
this is
super
lovely.
subtle.
But I know that other people won't notice this, but I can really see a difference.
Oh, good. I'm so glad.
Yeah.
That's awesome.
Like my face is, it's back up here. It's not
Agreed.
down here anymore. Yeah.
Exactly. Like, I think that adding just a little bit of filler, because you already have beautiful cheeks, like I said, you didn't need much at all. But getting rid of those little lines really does help and give you a little bit more of a youthful look.
Whoa. Wow. This is so subtle, but so nice. Like,
Yeah.
exactly like a.
Yeah.
Good job.
Oh my god,
Thank
you're an
you.
easy canvas. So I
Oh my
made
god,
my job
look at
easy.
me. Some of this I've done my own research on already, but just to double check, like in terms of picking back up with exercise and like sleeping, do I need to sleep upright a little bit?
I would. So it's not a 100% necessity. You don't have to sleep at an incline. However, I would recommend it the first 2 nights, just because we did touch up on your cheeks a little bit, and if you're a side sleeper,
I'm like face down.
Oh yeah, then for you, try to flip it back over. I know it's hard, but I just don't want anything to smush the progress that we've made, and that's only for 2 nights, so don't worry about it. Once after 2 nights have passed, you can't mess it up.
Okay.
As far as exercise goes, wait 48 hours. Most of that is just because of the swelling. I don't want this area to become any more swollen than it already is. Otherwise, you might push the fluid of your own body, like your blood vessels expand, it rushes through, and it can push the filler around a little bit, so we don't want that.
Gotcha.
Other things to be careful of: aspirin, NSAIDs like ibuprofen, Aleve. We don't want to thin the blood and cause potential bruising or swelling that we just don't want to encourage all that. So
Sounds good.
so thank you so much for tuning in and watching. You can call or email our clinic anytime to set up a consultation with me. So now we're going to be turning to the live chat, where we're going to be randomly selecting a question for a winner to win a free RHA treatment. So go ahead and enter any questions that you have, or just let us know what you think. Thanks, guys. Hi, everyone. Hope you all can hear me. Thank you all for joining. My name is Kate, as you saw in the video. Dr. Tyrone's PA here at North Florida Plastic Surgery. So as you just heard, we're going to be answering some questions live here. I already see some coming in. We're going to be selecting one at the end for a free treatment of RHA. So I am just going to kind of go to the top here and start answering some of these. All right, so I have a question here. On average, will 1 syringe be enough for problem areas like the mouth and nasal area? So everybody, of course, is going to be a little bit different, but the key word here is on average, will 1 syringe be enough? Typically, no. Typically, 2 syringes is what it takes to really fill in the nasal labial fold area. And if you have some laugh lines or vertical lines around the mouth, maybe you never even smoked in your life, and unfortunately, you just have these vertical lines or perioral lines. Typically, we need about 2 syringes to get the job done fully. We can make 1 syringe stretch a little bit, but I will say you need about 2 to really get that full optimal result. Let's see. And then I kind of just answered this one. Can it be used for lines above the lips? Yes, absolutely. Not much is needed for that area. We do not want to fill the subcutaneous lip or the area above the pink of the lip too much. That can result in looking too puffy, a little bit too filled. So you really don't need a whole lot in this area, but it can absolutely be used in that area. RHA is specifically designed for the mouth because it is so mobile in this area. Our cheeks don't move so much, our forehead doesn't move so much, but this area is highly mobile, talking, chewing, laughing. That's why it's so dynamic, is so we can move with, the filler moves with us instead of against us. So yes, it's a great area for RHA. Carly asked, how long are the results? So RHA has been indicated to last up to 15 months, which is fantastic because typically most of the fillers on the market today are only indicated to last about 12 months. So any extra weeks or months we can get out of a filler, it's worth it. So yeah, up to 15 months for this filler. Missy asked, how much does this typically cost per syringe? On average, it's about $700 per syringe, which is pretty reasonable. Our most expensive filler here costs $750. Our cheapest one is $625. So this is kind of right in the middle. How is RHA different than Botox? So Botox is a neuromodulator. It's used in the upper third of the face to relax the muscles under the skin so that you don't create wrinkles. RHA is a filler, a dermal filler, so it's meant to replace lost volume. So it's just expanding an area where you're just seeing some volume loss. So whereas Botox is relaxing a muscle, a filler is replacing lost volume. Yes, you can put RHA in the lips. The indication, the FDA approval right now is for the nasolabial folds and dynamic folds around the mouth. However, in this business, we use things like filler off label all the time. So I have been using it for lip filler. People have been really happy with their results. It does seem to be lasting longer than some of the other brands on the market. So I will continue to use it for the lips. How well does it work for older women? Honestly, it's the same as it would be for a younger woman. I might choose RHA 2 for someone with thinner skin versus RHA 3 or 4. So they have 3 different products. RHA 2 is for someone who has thinner skin, somebody who maybe has really superficial lines, thin lines that don't need much treatment. That would be RHA 2, all the way up to RHA 4 for those deeper inset lines or people with thicker skin. That's a great question, Joanna. In the model you used, how many total syringes of the product did you use? We ended up using 4.5. We used about 1 for those nasojugal fat pad separation where she had those little cute lines under her eyes that she just wanted to make a little bit more subtle. We used 1.5 for her nasolabial folds, and then we ended up using another syringe for her chin. Typically, if you're lacking in chin projection and you're looking to get a bit better of a profile balance, you need an entire syringe just to project your chin a little bit more. A little bit does not go a long way in the chin. Is there pain during the injection? So yes, we do provide a topical numbing solution. It's mostly lidocaine based, but it also has tetracaine and benzocaine, phenylephrine. It's a great compound. I leave it on for about 20 to 30 minutes, and that does reduce the pain quite a bit. It makes the procedure very tolerable. Unfortunately, there is some pain still involved, but it's very minimal. I've never had anybody not being able to proceed with the procedure, even people with true needle phobias. So it is a comfortable procedure. And I also provide distraction advices, like a little vibrator tool you can put on a prominence of the bone or even a squeezy ball. And we can take as many breaks as you need, especially if this is your first time and you're nervous. So don't worry about that. Does this product work on forehead lines? Unfortunately, no. That would be a neuromodulator like a Botox or Dysport. My rule of thumb is if it's the upper third of the face, it's going to be a neuromodulator. If it's the lower 2/3 of the face, it's going to be a filler. And we had that question. Good questions, guys. Curious about what dynamic means in relation to this filler. So when we talk about dynamic versus static, static is if you're just not talking, not moving, it's a picture of yourself. It's just a still picture, and you can see these lines. So for me, you can see these lines. These are considered static lines. Now, when I move or smile, these lines move with me. That's a dynamic line. That's a dynamic fold. So if I look great in neutral and don't have these lines, when I smile, I want that filler to move with me, not against me. I don't want it to look different or unnatural when I move or I'm dynamic. So that's kind of where RHA comes in, is that it moves with you, not against your natural movements of the face. All right. How long does it last? Again, about 15 months, up to 15 months, I should say. If you, what I found is that if you exercise a lot, if you are just a naturally high metabolizer, you can expect it to be a little bit less than that. But for the most part, 15 months. How often is treatment needed? That's pretty, it's a tough question because everybody's a little bit different. Some people that get the 15 months, I would say come back in a year so we can do a reevaluation. just to make sure that we're not letting it all wear off. I want you to do touch-ups along the way. Otherwise, if you let it all metabolize and get broken down, we're kind of starting at square one when you come back. I would rather do a full treatment up front and then do touch-ups every 6 to 12 months to make sure we're staying consistent. Another question about the cost. Let's see, I'm trying to find you guys a new question. 71 is not too old. I think my oldest patient is 85. 71 is certainly not too old. How long is recovery? Great question. Recovery is not long at all. You can go right back to doing work. I would say that the top two side effects and expected anticipated reactions are swelling and bruising. Anytime we penetrate the skin with a needle, even with Botox, there's the opportunity for a bruise. So I do say just be warned of that. It rarely happens, but it can happen. So if you've got an event coming up this weekend and you're planning on getting filler, push that filler appointment back. You don't want to risk getting bruised. Something that can help, and I always tell people this, especially in consults, is oral arnica. If you take arnica about 3 days prior to your injection appointment and then the morning of, it really cuts down on bruising. So I recommend all my patients take that prior to the injections. We sell it here in the clinic. It's about $20, worth every penny. I'm a major bruiser, and when I do that, I do not bruise. Let's see. It is the same price if you want to do your lips. So we price it by syringe, not by the area that's being treated. And typically for lips, it's just one syringe. I actually don't do more than one syringe in one sitting, simply because it's the swelling. You're just chasing swelling at that point. And I do not want to be injecting when you're swollen. And in an area that's as sensitive as the lips are, we want to make sure we're layering that product and not adding too much at a time. So if one syringe isn't enough for you, I always have you come back in 4 weeks and do another one. Oh my gosh, Shannon, you're so sweet. Sorry. Oh, thank you. Yes, again, it can be used in the lips. I will say in the lips, so a follow-up question to that was how long does it last on average? So again, 15 months, but I will say in the lips, it does tend to be a little bit less than whatever the indication timeline is, just because again, we're moving our mouth so much. It's a sheer stress alone does break down this product, any product that's going to be for filler. So to keep that in mind. That's why I always have people come back a little bit before the anticipated lasting date. So if it's 15 months, I always have them come back at 12 months. How much time do the injections take? So it depends on what you're here for. If you're here for cheek injections, cheek filler, it typically is about, the actual injections take about 10 minutes max. Lip filler is a little bit longer just because it does require a little bit more finesse. We want to make sure that this is just perfectly even. With your cheeks being so far on either side, you know, it's not quite as, the technique isn't quite as involved, but with your lips, you're going to be here for about 20 to 25 minutes with the injections because we just want to make sure it's absolutely perfect. But chin is very quick. The nasolabial folds are very quick. I mean, 5 minutes. Now, I will schedule you for an hour because I want to talk with you up front if we haven't had a consult, get a game plan to understand exactly what you're looking for. I also leave the numbing cream on for 20 to 30 minutes. So most of your time here is talking with me and numbing. The injections themselves are usually pretty quick. Yep, again, we charge per syringe or per tube as put here. Just trying to find some new ones for you guys. Diane asked, can you fill out the cleft above the lips if it's deep but narrow? I think you're probably talking about the area right between your columns here. You can do that. I have never been asked to do that before. I'd have to see you in a consult to see exactly what your skin quality is and exactly what you're trying to achieve. But yeah, I'd have to see you in a consult for that. Is the filler appropriate for the under eye area? Absolutely. I typically use RHA 2 for tear trough for under eye filler. It's been working beautifully. So yes, you can absolutely use it there. So, and how long does the filler effect last? So that's a great question, because how long it is indicated to last for and how long the results last are two different things. So when I say that the filler is indicated to last for 15 months, if you were to use a CT scan or something and look in the face, you would still see the filler in there in 15 months. However, the results are different. So that's why I have you come back around the 12-month mark, or if a filler is indicated to last 12 months, I have you come back around the 6 or 9-month mark, because typically that's about when your results are starting to fade. So yes, that's a great question. How long before an event should I have the filler done? I would say, just to be on the safe side, 2 weeks. 2 weeks is typically what it takes for all the swelling to go down, for all of your bruising to resolve. Some people heal very quickly from bruising, other people don't. And it takes time. So all of these hyaluronic acid fillers are very hydrophilic, meaning they love water. They love to pull in water. So when they're first placed, they're very much in their natural form. It takes time for that filler to pull in water from your body and soften up and really fill out. So it takes, the 2 weeks is what I recommend for someone if they've got a wedding, a graduation, something special coming up. Do it about 2 weeks out or more. Will this product help with jowls? Yes and no. So it's not going to make your jowls go away. Nothing is going to provide surgical results in a lift like a facelift. However, there are things we can do with filler to create the optical illusion that the jowls are softer or not quite as obvious. We can add cheek filler to lift a little bit and also create that more triangular appearance. As we age, we go from having a nice inverted triangle to having a regular triangle, and we don't want that squared off appearance. So with the jowls, it creates that squared off appearance. So we add a little bit of volume here to start giving you that inverted triangle, and then we can fill in a little bit in the anterior or forward portion of the jaw so that it conceals the jowl into the chin. So does it actually do anything for the jowls to remove them? No, but we can certainly create the optical illusion to make it look like the jowls are less prominent. What is the cost compared to Juvederm? So that was kind of the price range I was giving you guys before. Our lowest priced filler here is $625, and our highest price is $750, and those are both Juvederm products. They're just meant for different things. Can it be used for the dreaded T-zone between the eyes? Again, that's going to be a neuromodulator like Botox or Dysport. What is best about this filler compared to the others? So I personally think that the best thing about it is that it's the least cross-linked, making it hardest for our bodies to break down. The more cross-links a filler has, that's what our body targets to break them up. So if it has fewer of those cross-links, our body's going to have a harder time breaking it down. Also, this filler is the most similar to our own natural hyaluronic acid than anything else on the market. So it's, again, harder for our bodies to break down. It doesn't recognize it as much as a foreign product as it does other fillers. So for me, it's the duration or the longitude, but a close second would definitely be how natural it looks. Yes, it's sold per syringe. Yes, it can be applied under the eyes. Does repeating the treatment every 15 months smooth the lines and folds over time? There is a cumulative effect for sure. Again, I don't want you to wait the full 15 months, even though it technically is indicated to last up for that. I do want you to come back a little bit before that, just to make sure we're not letting it all go away. I do want that cumulative effect to take place. So yeah, it definitely, repetitive treatments smooth more and more. These are great questions, you guys. Thank you so much. Are there any restrictions when it comes to other prescriptions I may be on? There are not. I do ask patients to be cautious with blood thinners, prior to treatment, just because the more blood thinners you're on, typically the more you're going to bruise. But again, if you take arnica the couple days before and the day of, you're gonna be fine. Bruising typically isn't too bad when you take arnica, but otherwise, no, there are no medications to be wary of before an appointment. This is not an Allē product. So Allē is Allergan's rewards program. So Juvederm would be their competition to RHA. You still get points in Allē for using this, but you cannot use your points in Allē towards this. Is the needle changed between injections? I typically change out the needle if I'm changing area. So if I'm going from the lips to, let's say, the nasolabial fold, I will change out the needle just because there's different bacteria on your lips than there is on your face. However, I am constantly cleansing the area with either an alcohol swab or chlorhexidine or betadine. I constantly am cleaning. So it's not necessarily an infection thing. I do like to change it for more so comfort for my patients. The sharper the needle, typically, the more tolerable the procedure is. I don't like to change it too much though, just because we don't want to lose too much product into that syringe. There's a tiny little bit that gets lost when you change the syringe out. So I don't like to change it too much. What did you use on her face prior to the injection? So that was the topical numbing cream. We get it compounded here locally. It has a ton of lidocaine, tetracaine, benzocaine, phenylephrine, and urea to make it as comfortable as possible. If you're getting your lips done, I am willing to do a dental block that's 4 injections into the mucosa and it numbs your entire lip. I don't love doing it unless you absolutely need it though, because then you can't express during the procedure. If I need you to smile or pucker or do whatever to show me where the filler is settling as you're moving, you can't do that with a dental block. I've only had one person ever need to do that, but the topical numbing cream is phenomenal. It really does work. So Macy is letting me know that we are going to announce the winner. So Macy's our marketing agent. She said she's going to announce the winner tomorrow on social media. And we'll announce a time for that because there's just so many good questions here. We can mix it. We can. So Renee asked, can we mix the different types 1 through 4 at the same appointment, like one around the mouth and then a different type in the lips and nasal? That's a great question. Absolutely. So when you come in, you're not just, oh, you get RHA 2 and that's going to happen everywhere. No, I typically will use like an RHA 4 in the cheeks. And then if you're looking for just a really subtle, natural plumpness for the lips, I will use an RHA 2. Or if you're looking for a little bit more volume, a little bit more definition, RHA 3 in the lips. So again, it really depends on what you're looking for and what your facial structure is, how thick your skin is. A lot of things go into deciding which product's right for you. And yes, you can get more than one type of RHA product in a single sitting. Is RHA as likely to swell, absorb water as other fillers? Yeah, there hasn't really been a big difference in the swelling and the amount of water absorption with RHA versus other fillers. The ones that tend to swell the most are the ones that are denser. So RHA 4 is going to be your densest, so it's going to swell the most. But it's not substantial. It's not like, oh, here, if you get RHA 4 in your lips versus RHA 2, there's going to be a huge difference. It's swelling is swelling. You're not going to notice a huge difference between the two. If you have had CO2 therapy recently, can you still receive RHA? As long as you're healed from CO2, you can certainly receive RHA. So one of my favorite things to do if you're getting treatment for perioral lines or those lines around your mouth, wait 4 weeks after your CO2 treatment, and then we can go chase those lines that weren't completely corrected with your CO2 with the RHA. We do that all the time. So yes, as long as you're healed, I do like to wait about 4 weeks between your treatment and then doing a filler like RHA. If I needed this and say a different filler in another area, could we do them both in the same day? Yes, absolutely. Can you layer it on top of a different lip filler? Yes, as long as it's a hyaluronic acid based filler. So if you had lip filler 3 months ago, I have no problem layering another hyaluronic acid on top of it. Just make sure that it was hyaluronic acid. Besides anticoagulants, are there any herbal supplements or medications that are a concern when you receive the filler? Nope. Again, just blood thinners, like you mentioned. Try to, avoid those for the day of, and then take arnica instead, and that'll help you a lot. Let's see. I have answered this a few times, but I'll just go ahead and answer it one more time. So the main difference between RHA versus other fillers like Juvederm is that the RHA is indicated to last for longer than Juvederm, first. And second, it's the least cross-linked out of all the fillers on the market right now, meaning it's harder for your body to break down. It's going to last longer. It's also the least cross-linked, the more mobile, the more dynamic the filler is. So it moves with you instead of against you. So those would be my two main differences. I have used this myself. I've used it in my nasolabial folds, and I've also used it obviously on tons of patients. When my lips start going down a little bit more, I'm gonna use it in my lips as well. But yeah, I'm sold on this product. I absolutely love it. Will it fill in a butt chin? I have a John Travolta chin. Yes, yes, it will. We'd probably use the RHA 4 for that. Yes, it can be used for a deep tear trough. It's one of my favorite things to use it for. About 1 syringe is used for tear troughs or under the eyes. If a second one is needed, again, kind of like the lips, I'll have you come back in 4 weeks after the first syringe settles, and then we can add a second one. Can you use RHA under the eyebrows to add plumpness? I have never put filler under the eyebrows. Again, that's just kind of in that upper third of the face, highly, highly vascularized. I wouldn't risk putting filler in the forehead, between the eyebrows, or around the eyebrows, just because unfortunately, the risk of an arterial occlusion or blindness go up tremendously in that area. I would never put filler in that area. Some people will, that's fine. It's just something that I don't want to risk. Okay, a lot of the same questions here. Are there any procedures to so good question, Sarah. Are there any procedures to avoid after RHA fillers, like RF microneedling, all therapy? So yes, after you've had filler placed, especially if it's superficial filler, so the nasolabial folds, fine lines around the mouth, you do not want to do microneedling, just because as the microneedling pen penetrates the skin, it is breaking up the filler. So we don't want you to do any kind of microneedling for at least 3 months after you've had filler. And again, that's just because we don't want it to break down any faster than it does. How long has this been on the market and being used? So it has been on the market and being used in Europe for 7 years. Here in the United States, it finally received clearance last summer. So it's been the #2 most popular product in Europe for the last 3 years, behind Juvederm. And then here in the United States, it's finally getting its legs under it, and thanks to events like this, and people are learning a little bit more about it. Any major side effects? So any major side effects, again, the swelling and bruising are by far #1 and 2. There are, a couple of side effects that I always tell first-time patients about. Very, very rare. And I don't tell anybody this to scare them, but if you start noticing a lot of darkening in the area, that's a sign that I want you to come in. It's not scary at all. That's why I use hyaluronic acid fillers. These are reversible fillers. So if anything were to happen, we just inject a little bit of hyaluronidase, boom, everything's back to normal. That's another good point too, is that if you don't like your result for whatever reason, again, I've never had to do this, knock on wood, but you can dissolve the filler. This is not a permanent filler. It's not a semi-permanent filler. It is easily dissolved with an enzyme that we carry here in the office. Let's see. In actual patients, what is the longest time anyone has had to use it repeatedly, and how effective is it over time? I maybe don't quite understand the first part of the question. I'm really sorry. What is the longest time has anyone used it? I'm really not sure. Maybe I'm just not asking, understanding the question. If maybe you could ask it again one more time, I'd appreciate it. Oh. Okay, so this is funny. What is the biggest impact to make my ex cry the most? I'm sure you look beautiful as you are, but if you want to come in for a consult, typically, I'm not sure how old you are or what you're looking for, obviously, until I see you, but I'd say my most popular injection site would be the lips. It just is. Right now, it's still trending. It's still our most popular injection. It's still our most popular request. But cheeks are also a necessity, in my opinion. If you're looking for nasolabial fold filler, I almost always recommend at least splitting a syringe between each cheek to provide a little bit of lift before going in and contouring the nasolabial folds. But yeah, I mean, to make someone jealous, you obviously got to do your lips. All right. How long does the appointment last? Generally, good question. I always schedule filler appointments for 1 hour. Again, that's typically the first 5 to 10 minutes are just spent chatting, making sure that I'm on the same page as you, understanding what your wants and desires are. I typically ask for a picture of like what you like, what you find to be attractive. Then I leave you numbing for 20 to 30 minutes. Again, the longest injection site is definitely the lips, which can take up to 25 minutes, but it's more like 15 to 20 minutes. Again, cheeks, nasolabial folds, chin, super quick, between 5 and 10 minutes. The cost of one syringe is $700. So Jessica, the giveaway, we are actually going to announce tomorrow on social media on our Instagram page. It's Dr. John W. Tyrone on Instagram. And we can also email blast for the winner as well. We're going to be basically just choosing a question, someone who asked a question here, and announcing the winner. The prize is a free treatment of RHA up to 3 syringes. Shannon says she's a little late to the meeting. Can she has microneedling if she used this product? So again, we do ask you to wait about 3 months to get microneedling, especially if it's with RF after receiving filler. Typically in the cheeks where it's placed really deep, you can still be okay. But if you're getting the nasolabial folds, lines around the mouth, definitely wait to do that because that's too superficial and the microneedling will break it up. Crow's feet is more Botox. That's correct. If I bring you carrot cake, can I get this? Can I get in sooner? Yes. Absolutely. Bribery works for me. If you use a 4 in the chin and 2 in the lips, would that be considered 2 syringes? Yes. Yes. Absolutely. And you would need at least 1 syringe in the chin and 1 syringe in the lips anyway. So that's expected. That's fine. So Kimberly asked, if you have used Juvederm or another filler in the last 6 months, do you need to wait to use this new filler? Nope. You can use Juvederm and this product together in the same treatment if you want. Totally fine. They play nicely in the sandbox together. The worst area is the lines on my forehead. Again, that's going to be Botox or Dysport to relax those lines. Sometimes if they're really bad, I know this is an RHA discussion, but if your lines are really deep and etched in the either the frown or the forehead lines, you're going to need more than one treatment. You're going to be really consistent about coming in for your neurotoxin because they're not just going to iron out in one treatment. So sometimes it can take up to 3 to 4 treatments to really see those lines soften up. My husband asked, are you going to answer questions all night? I'll be here all night. Typically, how long does the bruising last on the lips? So everybody's a little bit different. I'm a major bruiser. So my bruises can last up to 2 weeks, and that's unusual. Typically bruises last between 3 and 6 days. But if you're like me, or an unfortunate person like me, it can last up to 2 weeks, which is again why if you have something coming up, I always recommend waiting, at least getting in 2 weeks before your event. But yeah, about 3 to 6 days for bruising on average. Skin procedures are okay to do after the filler injection. So you can do just about any kind of skin procedure after filler. You can get a facial, you can do all therapy, you can get a massage, you can do just about anything after filler. You just don't want to do the microneedling because it's just going to break it up. I think maybe you meant large pores. It says, does this help make large pools look smaller? But I think maybe you meant pores. I'm not sure. And it doesn't do anything for pore size though, no. I have not used RHA on the neck or the chest before. I don't know that I would. Again, it's just, there's so many important organs and vessels and arteries in this area. I just don't think I would put filler there. You might find somebody that will, but I wouldn't put it there. I would do it in the chest area though. There's a nice amount of thickness here that we can look at the chest wrinkles and see what we have working with. And again, come in for a consult and we can talk about it. All right, I am actually caught up on questions. Thank you guys so much for joining. I'll stay on for another couple minutes in case there's anybody who thinks of anything that hasn't been asked yet. But you guys have been great. Thank you so much for watching. If you are interested in a consult, please just call our office. Our number is 352-332-1150. Again, my name's Kate. Ask for me. I'm here Monday through Thursday. First appointments at 9, last appointments at 5:30. Anytime. Where are the injection sites under the eye? So everybody's tear trough or under eye is a little bit different. Some people have a nice tear trough extending from the corner of the eye down the cheek. Some people have just hollows kind of following under the eye. So depending on where your volume loss is where exactly where the injection points go. And I aspirate, meaning I pull back on the plunger with every single injections to make sure that I'm not in a blood vessel, and it's very safe. I know the eyes kind of freak people out a little bit, but it's a very safe area to inject. Are fillers preventative like Botox? Controversial. So Botox is absolutely preventative for wrinkles. I'm all about preventative Botox. If you don't have lines, you don't have to treat them. So if you're young and considering Botox, please come in. We'll talk about it. I'll give you all of the pros. I don't really think there are any cons besides just loving the way you look. Filler, I'm not going to say it's preventative. It's more so I would never put filler someplace that somebody doesn't need it. It's more so to replace true volume loss or to create volume where in a place that you wish you had had more. So I wouldn't call it preventative. Any contradiction with antibiotic allergies? No. Not at all. As long as you're not allergic to lidocaine, this is a safe product to inject. I will say some fun things that I always ask you if you come in and we're about to do injections. If you're doing lip injections, I need to know if you've ever had cold sore or a fever blister. That doesn't mean you can't get lip injections. That just means I want you to be on Valtrex for that day and several days following to prevent a cold sore from forming. If you've been on antibiotics in the last 4 weeks, I need to know about that and why you were on the antibiotic. If it was an infection in the face area, especially if it was a dental infection, we're going to have to push the appointment back by at least 4 weeks after you stop taking that antibiotic and the infection has resolved. If you've received a vaccine in the last 4 weeks, it's not that you can't get the filler, but I will warn you that there is a chance that you can have an inflammatory reaction to the filler. Super easy fix. I just put you on prednisone and an antihistamine, and that takes all that inflammation away. Those are really my big things though. So if you have any questions about how to prepare for a filler appointment, please just let me know and I can send you an email with all of these things. All right, guys. Well, again, thank you so much. Go ahead and give me a call, make a consult. I'd be happy to see you in person. And if you want me to just give you my opinion and go from forehead down to the neck and tell you what I think, we can do that. Or if you have something in mind, we'll talk about that too. So thank you so much for joining me. And thank you so much for your questions. It's been a pleasure. And I hope to see you soon.